My name is Michael Krupa, and we're out here at the site of TaraVista Behavioral Health Center. This project is really the culmination of 30 years of my career working as a psychologist. It permits our staff to be able to reimagine what care can be like. So we have a spectacular setting, we have a spectacular building, and we're in the midst of both completing the construction and beginning to recruit doctors and nurses and social workers to come join us in what we are certain is going to be one of the absolute best places to practice and one of the absolute best places to receive care for behavioral health issues within Massachusetts and beyond. This is our ambulance and intake entrance. This is the first view that most of our patients and their families will have as they enter the building. So wonderful to be out here in this courtyard today as we've completed the construction phase of our project. We've hired staff members, we have patients who are now here in the building. We're standing in our completed space now with these vibrant colors, these open hallways, open nursing station that really encourages interaction between our patients and our staff. Our community room is large, spacious, has fresh food served daily. A part of what we're able to provide is a very soothing and quiet setting. We've got these quiet social areas with great views that are out to this woods behind us, and that each have an aquarium on them. We have this capacity to bring nature inside the building. We have these beautiful views, and we're able to have our patients and our staff come and access the outdoors through this beautiful courtyard. We really view a natural setting as one of our treatment tools. We knew it was very important to have the voice of patients, of their family members, of doctors, of nurses, of mental health workers at the table with us to help design the space and to help design the programming.